Hello everyone, this is Suparna Dikshit from Bugandai Tech Private Limited, and in this video we are going to discuss a use case on Salesforce Health Cloud, which is hospital and patient journey. After watching this video, you will have a better understanding of how Health Cloud can be used for scheduling appointments in hospitals and how patient records can be managed via Health Cloud. So let's begin. Suppose this is the Health Cloud console, and here there is a list of all the patients. From here, I am going to click one of the patient for which I have to book an appointment. So in this tab, on the person account, we can click on the schedule appointment tab with the help of Salesforce scheduler, where an appointment can be scheduled based on patients and doctors availability. So after clicking on the tab, we will get this select service resources. Here we can select the account, whichever we want to. Suppose I am clicking on the parent record account, that is Phyllis Cotton, and either you can select a service resource which is grouped by work type, appointment type, service territory, or either by name of the service resources, whichever you want to book, you can. So here I am selecting by work type, group, appointment type, or service territory. So on clicking next, it will navigate me to the schedule appointment screen where we can select the work type group, that is cardiology. Either you want to visit a cardiologist, the physiotherapy department, either you want to visit physiotherapist or any other. It is customizable. We can add all the departments accordingly and all the specialists here. So here I am going to select the physiotherapy. On selecting next, it will redirect you to a select appointment type. So either you can book your appointment via phone, or you can walk in at a branch, or you can do a video call. So here I'm going to select phone. Next, after clicking here, it gives an option to select the service territory. So since this is the developer console, this option is not enabled, but we can enable the maps and locations where the location, or we can track the location. So this is how an appointment is scheduled with the help of the health cloud for a patient, and the patient and even doctors, the availability. Like suppose if I go to schedule appointment here, I can see the days, the preferable days on which I want appointment, the time, that is any time, morning, early morning, afternoon, evening, the provider preferences, etc. So this is the overview of scheduling appointment. Now let me just walk you through the patient card. So the patient card gives the complete comprehensive information about the patient's info and conditions. So it has three components, that is patient info, patient navigation, and patient card. In patient info, we have the basic information like the patient's name, his birth date, gender, or you can also add photograph. This information is non-customizable. We cannot customize it. Next is the patient navigation. So from patient navigation, it helps us to navigate to the pages straight away. It takes us to the timeline functions. For example, if I click on the timeline function, it will straight away take me to the timeline, and here you can add more options. For example, you can select all events, start date, day to show, etc. Next comes is the patient card. So let me patient card. Yeah. So here you can get all the information about the patient's medical conditions, his risk level. So basically they are coming from different fields, different objects having relationship with the account, because of which we can get a full overview of the patient data. For example, his guardian, languages, medications, immunizations, allergies, campaign, last encounter, etc. So this is how a patient record provides us with comprehensive view of the patient.